Hello everyone. Today let's discuss the old subject one more time about how many eggs need to make a live birth baby. One of the major components in the process of in vitro fertilization, so-called IVF treatment, is direct treatment of ladies and to get a certain number of eggs and so-called ovarian stimulation for obtaining of multiple eggs. How many eggs we really need? Do we really get more good eggs if we produce more eggs? I get two different kind of questions. One question is that Dr. Zhang, I think IVF is a game of number. The more eggs I have, the better chance of making good quality eggs. I also heard the other lady will say, Dr. Zhang, the reason I'm going through IVF or the treatment I recommended is because my tube is blocked. I have 3 babies before and it was so easy. Why all of a sudden I need so many eggs to make babies just because my tubes are blocked? So this is actually a very common question and does not have a simple answer. The reason for that is it really depends on the patient age, the reason for the fertility, and what's the purpose of going through IVF. Let me give you an example. If a lady 37 years old planning to have 3 children and this is their first attempt to get pregnant, they may want to make more eggs and produce more embryos and freeze some embryos for future baby. And they will make more eggs. Now, what about the lady at the age of 42 want to have a first baby and they only want 1 child, and at 42, it's only 5% chance to make a good quality eggs every month. And no matter how many eggs you produce, you may not make more good quality eggs. So in this group of ladies, is that still true? Make as many eggs as you can. So this just to give you 2 examples that there is no one answer to answer all questions was being raised about how many eggs really needed to make live birth babies. Now, if you look at my previous blogs, we already discussed in great details about how many eggs need, how to do the stimulation. I mentioned about the minimal stimulation IVF, natural cycle IVF, and the so-called conventional IVF with daily injections. So I just want to touch on something which you probably didn't really spend lots of time to discuss before, is about biological wastage, meaning that how many eggs are being wasted before making 1 good egg to making live birth baby. In the natural cycle, lady eventually at the time of ovulation, you only produce 1 egg. This is called follicle, and this is all small follicle. So by the time you reach ovulation, the typical day 14 of the menstrual cycle, for 1 egg. That's called natural cycle. Natural cycle means the lady only without taking any drugs. So if we give more medicine with the injections, you may make more eggs. However, there's a limit. The young lady, the more good eggs you can produce, but when the lady reaches to 39 or 40 years old, you still can make as many eggs as you want, but there may be only 1 or 2 might be good per attempt. If you look at the number of the eggs produced in per lady versus how many live births the lady produced, usually is about 1 or 2 to 10, meaning that every 10 eggs, probably 1 egg make babies. So for the lady at the age group that most eggs will be poor quality eggs, then you do need to produce more eggs to make live birth babies. But here's come to the important question. One way we need more eggs to find 1 good egg, but every month the percentage of the good eggs you may produce is very different. So if the lady in the group, they don't make many good quality eggs, then making too many eggs may not necessarily give a better chance to make more good eggs. So that comes to the next question about how do you assess a success IVF cycle, and how to assess which IVF program are more successful. And there are many ways to look into it. One way is a traditional way. It's just look at 10 patients started IVF treatment and how many patients got pregnant. Other way is to look at how many eggs average needs to be produced to make one baby and at any given age. So that will make a difference. I will show you the chart and you will understand. This shows 4 human eggs. This is human eggs, 1, 2, 3, 4, to produce 1 live baby if your age is 35 years or younger. Okay, so usually you need to have 4 eggs to produce 1 live birth baby. That means the chance each egg good is about 25% chance. If you are 36 years to 38 years old, you might need 1, 2, 3, 4, 5, 6, 8 to produce 1 live birth baby. If you are 39 to 40 years old, you need to produce, based on our data, you probably need about 22 eggs to produce 1 live birth baby. So what I really want to make a point or explain to you all is that it's not always correct or needed that if I want to have a best chance to make a baby, I need to make the maximum number of eggs possible. That's what I want you to know. And secondly, for the ladies, if they do not make more eggs, this is really not a major determining fact that you're going to have a low chance to get pregnant. It just means that we may need to use different protocols. You don't need a heavy drugs. You will go more natural or minimal approach. That have nothing to do with the overall chance you have a baby or not. Of course, as long as you're making eggs. So I'm going to show some charts to explain to you more about what really I meant. Okay, let's look at these charts. For example, menstrual cycle mainly taking oral pills with a few injections to produce 1, 2, 3, 4 eggs. That should have most of the best quality eggs in the mini IVF. If you take heavy 3 injections every day, 3 injections every day, 3 days injection, 3 injections a day, 3 injections a day, it's called a conventional approach. You will make more eggs. But still, the first 3 eggs might be good, and this all going to be wasted. Not only wasted, since you do need more eggs to produce 1 healthy baby, so that means theoretically you need more cycles. But if you're going through such a heavy stimulation, then your ovary may not be able to have a good condition for a long time to come. And when less medicine will allow the follicle to grow and the ovary to stimulate for many more cycles to come. The ovary give you a chance to make more good quality eggs. So this is what I want to explain to you. So in conclusion, take home message is that less medicine, gentle approach, mini or gentle, or now second more organic approach, less medicine, is more suitable. Day 2 of your cycle, day 14 for retrieval, egg retrieval. The cycles, as more favorable patient will be either older than 40 years old or have less than 4 antral follicle or with AMH less than 10 1.0 or FSH on day 3 above 25, I think minimal stimulation is the best option. And I will stop here today, and we will continue this discussion. And in the next couple of blocks, I will have some case study to show you some real case, and we'll start from there. Have a nice day.